if you can also speak it instead of, I mean, you can use a chat box too, but I'm very slow to reading, and it also helps other people kind of like hear your question and your thought process. So, and welcome to Zoom. It was mentioned, my name is Dr. Tsige Gebreslasse. I am a chief resident at the University of Minnesota, specifically an internal medicine chief resident. And I completed 3 years of internal medicine residency at the University of Minnesota. Kind of give you a little bit of my background. I was born and raised in Ethiopia, in very rural parts of Ethiopia, a country in East Africa. I was born to a family of farmers and moved to the United States at the age of 17, so kind of in the middle of high school. I didn't speak English or anything like that, and my younger brother and I actually moved to the Chicagoland area and lived with relatives for a couple of years, but then moved on our own, and we've kind of been on our own since the age of 18. Medical school was an interest for me because what it gave, the ability to combine teaching and science, was very important for me early on. I really liked science, and I also liked teaching. And initially I actually wanted to be a teacher or an engineer, but eventually decided to go to med school, mainly because again, medicine was just a way of combining my love for science and also helping people by teaching at all levels, from the bedside, like teaching your patients, all the way to teaching trainees. I did my undergrad at Wheaton College in Wheaton, Illinois. So hopefully some of you are from Wheaton. And did medical school at the University of Illinois in Chicago. I took 2 years gap between undergrad and medical school, mainly because I absolutely had no idea what I was doing. I tell people that I didn't know what MCAT was until the spring of my senior year, which is way too late. But here I am now in medical, and I mean a physician. So, and I did a post-bac year actually also at the University of Illinois. So that was the second gap year, and enrolled or matriculated at the University of Illinois, completed my medical education there, and then moved here to Minnesota for residency. Throughout my medical school career, I have been involved in global medicine. And for me, global medicine doesn't really necessarily mean going overseas, but have also incorporated what I call global is local. Currently, in addition to trying to be engaged in communities in Minneapolis, I do go into a rural part of the US. I actually just got back from Rosebud, South Dakota, where I did hospitalist medicine for 2 weeks. It's a very underserved community. Right now, I wear many hats. As a chief resident, my role is to do clinical work, administrative, as well as education. So that is where I will stop, and I would love to answer some of your.
Oh, you muted yourself again, bye.
Sorry, I don't know why it keeps muting on itself. Just to say a little bit about, about 2 months ago in June and July, we had pre-medical students from one of the liberal arts school in Minnesota. And I helped teach as a course, an introduction to healthcare course to pre-med students like yourself. So I was very fortunate to be a part of them, and hopefully they prepared me well for this talk, so.
There was some questions that were already submitted beforehand. If nobody has a question, I can go through that, and someone comes up with a new one they can ask.
Sounds good. And we can start with those questions, and y'all can speak about them.
Okay, what's one piece of advice you wish you had gotten sooner in your pre-med journey?
That's a really good question. I wish that somebody had told me that I can still be a physician despite, well, regardless of my major. So I think that's probably something that you already know, that you can major in philosophy, economics, business, or whatever you want in undergrad. And as long as you take the pre-medical courses, the pre-med courses and MCAT, you can get into medicine. I unfortunately majored in biology because I just didn't know my so my path is actually that after high school, I went to a community college. So at a community college, my mentor was like, oh, if you want to be a doctor, you should probably just major in biology. I'm a person of a huge interest, from like politics to finances to philosophy. So I wish that I had satisfied some of my curiosity as an undergrad. So I think that was one thing. And the other thing that I felt like that's not given too much to pre-med students, but is important, is medicine is not about you trying to get into medical school. Many of us are focused on checklists, and that probably, although it's good to have a checklist, it's important to tell a story instead of checking out boxes. I did forget to tell you that I'm also actively reviewing medical school student admissions at the University of Minnesota as well. So when I look at somebody's application going through their med school AMCAS application right now, I look at a story and what they've been involved, and how a lot of their activities, what kind of story their activities tell me, whether it be a research or a volunteer service or a paid job or whatever. People say that you have to volunteer. I don't think that's necessary. You can volunteer if you can. However, myself, I couldn't volunteer because I had to work to live and to pay my rent. And I don't think nobody could have faulted me to stop working or start volunteering while I couldn't, you know what I mean? So really, people that are reviewing your application are looking for a story.
That's a really great answer. Here's another question. This was like a really common question. What sort of challenges do you face because of your race, age, or sex?
There are books and lots of resources allocated to this. What we call bias or microaggression in medicine is very real. We were just talking about it right before this meeting in a different meeting. As a woman of color, as a Black woman, as an immigrant, and I'm pretty short, so all of those work against me in medicine. However, I think that what I notice, especially from my patients and everybody else or my colleagues, is that as long as you stand on the values that you believe in, you can overcome them, and you have to just be honest. But to answer the question of what are the things that you face a lot of microaggression. I'm a very direct person. By the virtue of being an immigrant in this country, I had to sort of create my own culture. So I'm not like an American, I'm not an Ethiopian, I'm very, and I think a lot of us identify to that, especially our generation, right? Some of us are first generation immigrants, some of us are from urban world, some of us are from rural, some of us are, from so many parts of the world that, we have created an identity, and sometimes that identity can be challenged in many ways. Some of the examples that I can give a little bit concrete is right now I do go work in rural Minnesota called Cloquet. It's 20 minutes outside of Duluth. You guys know where that is. And when I walk in, many of my patients are you kind of see them just kind of like taken back. This is like when I walk in and say, hi, my name is Dr. G. I'm going to be your doctor today. This is the the kind of the gesture I get is like, really, kind of thing. And you kind of just keep on. And then by the time I walk out of that room, I know I've made an impact because I have made an intentional decision to get to know them. And that is just because they don't know any better. Or that my favorite quote is, my enemies are people's story I don't know. Just remember that. If you try to listen and hear people's stories, you'll always find common grounds, no matter where, no matter who, no matter what political support, no matter what ethnicity, no matter what.
Thank you so much. That was a great answer. You talked previously about taking 2 gap years because you didn't know exactly what you wanted to do right out of college. But do you have any advice for how to be productive and effective and kind of increase your competitiveness on your application through your gap year?
Yeah, it's a good question. So let me give you the objective things that I look as a person who's reviewing. I'm just gonna speak for what I do right now as a person who's in a medical school admission committee, right? We look for, although there are a lot of things that, let me step back. Although we look for what we call a holistic approach in reviewing people's application, a few things are going to be important. So are you trying to, when you come to medical school, are you up for the academic challenge, right? And how do you prove that? And how you prove that is through your GPA and your MCAT, right? We know, however, that sometimes MCAT is a one-day scenario and you can have a bad day and your MCAT can be horrible. But when you look at your GPA throughout 4 or 5 or 4 years of school, you kind of are looking at like trends, right? If freshman was horrible, then did you actually improve your second year, third year, fourth year? So we kind of look at trends, and if we do see a dip, you can have like a 3.8 GPA, first and second year of college, but then if that didn't continue as a fourth year, then what happened, right? We look for stories to explain those things. So, and if for us, for people to be strong candidates, your GPA really has to be above 3, and especially if it's above 3.5, then we say that your academic satisfaction is met. Okay. And then the next thing we look, so just because you got 3.8 GPA doesn't mean there's a guarantee entrance, right? Even with a really high MCAT score. Many medical schools right now aren't even looking at MCAT. Right now, when I review medical school applications, I actually don't look at the MCAT. The MCAT is not even revealed to me because we are trying to not be biased by numbers, but really try to look the holistic approach. And the next thing we look, besides academic satisfaction, is community service. Like, who are you as a person? What do you do in your community? What kind of volunteer services have you had? What kind of jobs have you had? What kind of life experiences have you had as a person? Have you had to work for, if you tell me that you've had to work and earn a job before 18, like, I'm gonna look at that differently, right? What led you to do that, and what's your story, right? Can you overcome the challenges of medical school? And those are important things. And nowadays, especially with what's happening with historical injustice in our society, your involvement in these kind of things is critical. So I highly encourage you to really think about what we call social determinants of health, and how societal factors like race, gender, geography, and all of these things do impact individuals' health. I think that has been neglected for so many years, and nowadays it's in the mainstream. And truly, we are looking for individuals who really, and you don't have to be part of that community. You don't have to come from a community that experiences high burden of disease in order to understand that, right? Just like we learn how to do geography and like math and all of those things, we can also learn how these factors like this, race, gender, geography, and other things impact individuals' health, and how you can also make a positive impact in turning that corner. So those things are really looked at, and they're especially now they're heightened, I will say. And so don't neglect that part of your application. So if I was, a person who had a pretty strong application or I would say like moderate application, and I was like, you know what, I can take a couple years to try to really understand. I could pick up a job, I could take a post-bac or something. But one thing that I would probably add to that, which is really trying to understand the process of disease and burden of disease. Does that answer the question?
Yeah, it does. Thank you. Another thing a lot of that's kind of coming into the conversation more is mental health, and kind of dealing with that as a medical student and also as a doctor. So how do you deal with the stress and like the responsibility of taking care of your own health as well as your patients when it can get very difficult?
Yeah, and that's a really, really good question. You guys are way ahead of the curve, because I don't think I had these questions when I was in your shoes. So, so the burnout, or what we call it, what do we call it? Moral crisis. I think we actually were talking about this, and there's a new medical term for it. So we call it moral injury of clinical work. That's kind of the term that's been used now, is moral injury of clinical work. That is the burnout that physicians experience because of many factors, but what clinicians experience. In my opinion, there are many, and the literature does say it too, and it's also what I experience in my colleagues and myself as well. There are a few things that contribute to burnout as a clinician. And if you identify those things, then you can try to, especially you guys, as you are thinking about medical school, you can try to identify these things and try to carve out your career so that you can avoid burnout, right? So what are those? Number one is financial. I know that about 75% of physicians have very high student loans, and it is expensive. So I actually have a talk about how to reduce how to think about finances in higher level education that I gave for the pre-med students. So I'm happy to give that in the future if you want me to. But student loans are a big deal. You are told that as a physician you're going to earn so much, and we almost neglect how much med school costs, and that you're almost told in society that you shouldn't even have to think about it because you're going to deal with it when you become a physician. I will encourage you to not listen to that advice and really think about financial health starting now-ish. And there are a few things you can do to prevent from taking huge loans. Avoid personal loans if you can, avoid credit cards if you can, pay them off sooner, really avoid high interest things. So that's one thing that's a burnout. I think about 30% of physicians, I guess I'll give you the average student loan for physicians, I think is about $250,000. That's a whole house, okay? Like in 4 years. American typical mortgage takes about 30 years. And just like when you walk out of med school, you're gonna say, does this brain actually, is it worth $250,000, right? So that's what it is. That contributes to high burden. The other thing is, when you think about, if I ask all of you here, individual of you, why you want to go to med school, you're probably going to tell me somewhere like, oh, I want to help people. Okay. I'm going to tell you right now, as a physician, you don't help a whole lot of people. And I think the realization comes later, once you actually become a physician and you say like, well, I spent this many years trying to figure out what I want to do, and I now have this much loans and have neglected all my family for this many years, and I'm not even making that much of an impact in society. What does that mean? So that causes like almost like a moral injury and a crisis in a physician nowadays. okay? And the way you look at this is really your job is to minimize suffering. It's not to eliminate suffering, right? Because elimination of suffering happens from an early age. Like when you're born or before you're born, you have to be born in a perfect society to not have suffering. So you cannot eliminate suffering, but you can augment it, right? So when your patients are suffering from pain, from a loss of a loved one, or from disease, and from financial crisis, or from whatever, your job is to be there and to help them go through that suffering. If you look at it that way, your burnout will be a little bit less. So the whole idea of I'm going to be helping everybody and everything's going to be fine is, as a physician, you're coming to the person's life a little too late, right? You're meeting a lot of your patients once they have developed diabetes, once they have developed hypertension, once they have developed heart disease and all of these things, right? So you're trying to minimize suffering. Having a public health kind of background helps in terms of sort of like looking at it at a population base and how to prevent disease. That helps a little bit, but it's obviously not always useful unless you want to. So we talked about like the idea of like just like work being difficult, finances, and the other thing is relationships, right? Whether it be it like romantic relationship or family relationships. I'm from East Africa, where my family do things last minute, right? So I'm sure I see a lot of people here kind of smiling, and it's true. Many of our families are like, next week we have a wedding, you want to join? And you're like, no, my like year is all planned. I cannot. It's inflexible. So you miss a lot of your family get-togethers, your friends get-togethers, and with that becomes also personal relationships or romantic relationships also can become challenging. I think a lot of times we have to be okay, and our family can also be people from the community that are going through it with us. And so being flexible with the idea of family, taking time to explain to your family. I tell the story when I was in medical school. My dad, he's back home, and he calls me and he says, when are you going to get married? Like, this is like when I was a third-year medical student, right? So he's like, when are you going to get married? Like, isn't school like, shouldn't it be like over? Like, it's too much, what's going on? And I was like, well, I I'm in school now. So it'll be over soon. In 2 years I'll be done, and things will be okay. And he's like, okay, we finish with that. And then 2 weeks later, we're having a conversation, and he asks me, like, aren't you going to be done with school? I'm like, Dad, I just told you 2 weeks ago that I was going to be done in 2 years. Like, how does that not make sense? So I tell the story because you have to be patient and repeat yourself so many times with your family, whereas maybe some of your family members are like, they're buying you flights, or they're, sending you gifts, and like, that's okay too. That's great, like, wonderful. But for those of you that don't have that kind of support, you just have to be patient, and you have to be willing to explain to your family over and over that you're in school forever. So I think those are the 3 things that I can think of that contribute to burnout. But try to read some things beforehand, and kind of just, as long as you have a good overview or balanced life, you probably be fine going through med school and being a physician.
That was a really great answer. It was really like thorough. Also, I'm seeing Maya, your hand's up. Do you have a question? I don't know if you want to ask.
Yeah, I do have a question. Sorry, I'm not able to turn my camera on, but okay. I heard you talking earlier about rural medicine, and I know that there are some challenges that specifically like rural physicians face. So I was wondering if you could talk a little bit more about that. And yeah, that was my question.
Yeah, I'm happy to comment. Certainly not an expert in this area. the place I trained is the Twin Cities, so very metropolitan, you know, lots of resources, be it in its own way different, but and not rural for sure. Where I go to pick up a few shifts is about 250 miles north of where I am, and it's only 20 minutes, like I said, 15, 20 miles east of Duluth. So that's considered a little bit rural. And the challenge of rural hospitals is that long ago, right, 5 years ago, maybe 10 years ago, 20 years ago, that's considered long ago for me. There used to be a lot of independent practices in rural part of the world, right? I mean, rural America mainly. As those physicians aged and retired, there was almost like a vacuum. Nobody could fill this hospital systems. They also got bought in by big health systems. So if you live in the Twin Cities, you have heard of like Health Partners, you have heard of Alina and all of these things that are, or Mayo Clinic, for example. So now medicine has become regional and like based on health system and not based on community, right? So some rural hospitals are trying to stay independent, but that's costly, right? If you want to stay independent hospital and you want to provide OBGYN, you have to convince OBGYN, surgeons, orthos, heart doctors, you know, cardiologists and everybody to come and be there, and you have to incentivize them because it's rural and nobody want to be in rural part of the country, right? So because of those challenges, what rural hospitals have decided is to partnership or to be bought out by bigger health systems like Health Partners, right? So it's unfortunate, and the problem is, like, for example, in Mayo's bought up a lot of smaller hospitals, but they don't provide like deliveries in the rural hospital that they just bought. What they actually do is try to refer them to their center at Rochester, which can be hours, like sometimes 5 hours. So if you have a woman who needs to be delivered, you don't have anybody delivering that, you know, near her place, but she has to travel maybe 5 hours, maybe stay overnight. You know, many of our patients here stay overnight in the Twin Cities at a hotel and stuff like that to get specialty care. So those are huge challenges. I'm not quite sure how we are going to fix that as a nation. And I don't know if you know, I'm literally not an expert on this, so I don't think I can comment enough, but I'm not quite sure how that challenge is going to be overcome. But it's a real problem. It's a real issue where many physicians are concentrating in the city. Many of the resources are concentrated in the city, and then the rural part of the country is kind of neglected almost, and has high burden of disease. That's what I see here in rural Minnesota. That's what I see in rural South Dakota. But the problem is, of course, exacerbated when you are working in Indian Health Services, which is where I practice in South Dakota, is the Indian Health Services, which is also in its own health system that has a lot of problems. But does that answer your question, Maya?
Yes, it does. Thank you.
Okay, you're welcome.
Alex, you also have your hand raised?
Hi. Yeah. I have a question about admissions. I'm a healthcare worker already, and I plan on applying to medical school next year. I wanted to know, like, does that really help, like having that in your background, and how much does it help you getting in?
Yeah, that's a good question. So being exposed to the medical field is definitely a plus. I don't think that a medical school can consider somebody for an interview if you've never had any exposure to the health system, right? Like, because we want to know why, like, what a physician mean to you, what does a physician day-to-day activity look like, and etc. And I think that how much it helps is a good question. I think that the way they're looking at it is like a competency. So there's groups, right? There's your academic, like your GPA, etc. There is your community service, like your what we call just social responsibility, right? Like, how are you in society? How do you operate? And then there's this experience, right? So the experience is like, you know, do you have a good understanding of what it means to be a physician? Do you know what those challenges are? And have you had adequate exposure to that? So definitely helps. How much it helps, it's not going to be the only one that's going to get you to med school, but it would be a huge addition for sure.
Beatrice, you also have your hand raised?
Yeah, so this is kind of a personal question, but so I started college last semester, so I couldn't start like getting experience or anything, and I don't know how much because of the pandemic, I can't take the risk right now due, because of health reasons. So how do I get experience right now and in the future if I can't? Like, what can I do? I can't go to the hospital.
Can I ask you a question? Are you, what year are you in college?
Technically I'm a sophomore.
Okay. So I think this whole thing of how to get exposure as a pre-med during the pandemic is incredibly difficult. And I'm really, I feel badly for those of you who are trying to apply and trying to get this experience. One thing I will say is that medical schools are taking into consideration and how the pandemic has affected you. And you don't necessarily have to be exposed or have to work in the hospital in order to have that exposure. Shadowing people, even like telemedicine, or even like volunteering in the community with, contact tracing or whatever is available in your community is probably useful. I will say if you are a sophomore, you have plenty of time for us to figure it out and how things are going to turn out. You wouldn't be the only one who have this issue. I think that there will probably be an organized way of having pre-med people have experience or exposure to the clinical work. But I would say that continue to explore other avenues. Like I was a CNA from high school all the way to the beginning of residency, right? Because it paid me and I enjoyed the experience. And I didn't have to work in nursing homes I worked in all of those, but I also worked in the homes. So, that is somewhat of a low risk, especially if you are worried about exposure. Does that answer your question?
Yeah, that was really helpful. Thank you.
Great.
Natalie, you also have your hand raised?
Yeah, I just wanted to ask, like, what does a day in your life look like? And then kind of like how it looked before COVID-19 and how it looks now.
That's a good question. So it's really, I think what's so interesting about being a physician is your day can look like however you want it to look like. Okay, so I'm gonna give you 2 examples of how my day looked like. My day, and I think that one of the things to realize too is what does my day look like as a resident, which is like a person who, after you finish medical school, 4 years of medical school, you go into residency. And residency is anywhere from 3 to 10 years, depending on the specialty you choose. I chose to do internal medicine, which is a 3-year residency. Now, what does my day look like? I wake up at hopefully at 7. I guess what I'm going to give you is what does a typical, some of my colleagues who have decided to not be chief residents, but have gone to the workforce after 3 years of residency, what does their day look like? I'm just going to give you their day because their day is more typical. They will wake up in the morning and they'll go to work. They will see X number of patients and they'll write their notes and communicate with everybody to make sure that the patient is safely admitted to the hospital, taken care of, and safely discharged home if they need to be discharged, okay? And that involves a lot of communication with nursing, with social workers, and other things. They come home, they repeat that for 7 days, and then typically they're off this next 7 days, and then they repeat that every 7. So when you hear hospitals, which is like a new subspecialty under medicine, that's what they're doing, is what we call typically 7-day, 7 on, 7 off is what we call it. In a 52-week, you are going to be working anywhere from 23 to 26 weeks. Does that make sense? And I am looking for a job right now. I just had a couple of interviews in the Twin Cities for me to do that next year. So that's a typical job of a hospitalist. What is a typical day for like an outpatient person, which could be family medicine, pediatrics, internal medicine, anybody? We'll be seeing patients in the clinic, right? I'm sure you guys have gone to clinic visits to see your doctors. They are seeing multiple of patients that look like, you know, that have certain complaints. If you are, so that's kind of the clinical work, but what's so interesting about being a physician is you can really do whatever you want, right? So let's say I don't want to do too much of I don't want to see too many patients, but I kind of want to do administrative work. That exists, right? I can do a lot of medical education teaching. Like I can insert myself to the medical school and do a lot of teaching and less patient seeing. Or I can do basic science, right? I can develop, I don't know, I can help develop some medications or some research, right? I can get involved in a lot of things if I don't want to do clinical work. So as you go and as you apply to medical school and go through your career, you'll discover so many ways to fulfill whatever passion you have, whatever interest you have, and whatever skills you have.
Thank you so much.
You're welcome.
Maria, you also have your hand up?
Yes, hello. First of all, I want to say I'm sorry if I raised it like 5 different times because I couldn't tell if it was working or not, but okay. I just wanted to say hello. Thank you for doing this. It's so helpful. You have no idea. One of my deep concerns is that I am now a senior in college with a biology major, but I haven't always had the best of GPAs, and I've heard from multiple people that like, oh, you know, it's your story that matters because they want to feel like you would be, like it's not just about having good grades, it's also about your people skills. And so I would have to ask you, I mean, albeit, you know, a low GPA, for you, what would you see as an interesting story? Or what would make not like a boring story whenever you're reading?
Yeah, that's a tough question. No problem. I will say that, so I think it depends, right? Like, it depends about who you are as a person, right? So like I was saying earlier, I think that your academics just speak to how well you can do. Can you really handle the rigorous, you know, medical school? Like medical schools, you have to study, you have to learn, you have to memorize things, unfortunately, and you have to pass. And that's what we need to know when we look at your GPA. That's what we're looking for, really. And an interesting story, I'm not going to say an interesting, I'm just going to say like a good story, like a humanitarian story. I say to people that it is, it's easy to teach somebody to improve their grades, but it's really it's difficult to teach somebody to care, right? Like, I feel like I don't think I can like sit with individual of you and ask you or help you, like give you a strategy to care. Like you just have to, I feel like that's something that is been given to you or that you've developed throughout your life because of your family background, your society, where you were born, where you know, all of those things. And I'm not saying that you can't change it, but and it's you. Do you care? Do you actually care is the story that I'm looking for. Do you care about your community? You know, caring can be, I am a person in high school who had to coach or help my teammate that had broken an ankle, or her parents had died and I had to be there for her. Like, I think any type of story that reveals your humanity and that you care is a story that I'm looking for. And I don't think it's necessarily like, you know, did you go to Peru and look at this? You know what I mean? It's not, I'm really looking for the human aspect of you, because that's required in medicine. And that's a big part of being a physician, is trying to see human suffering and again, try to improve that or alleviate it. Does that make sense? Does that help in any way?
Yes, it does so much. Thank you for answering my question.
You're welcome.
I saw Maura, you have your hand up.
Yeah, I was wondering, when you mentioned the 7 days on and 7 days off, I was wondering how many hours you would typically do during those 7 days during internship and residency and how you'd manage that. And then I was also wondering, you mentioned about academics and research and how you could sort of tilt your career that direction if you wanted to. And do you have to do an MD PhD program to do that? Or what are your sort of thoughts about that?
It's a good question. And I will touch on those things as I think that they are kind of important. So the first question is the 7 day on 7 day off is a typical of what we call a hospitalist medicine, which is a person who's done medical school 4 years, and then they've done 3 years of residency, be it mostly in internal medicine, and they have decided to get a job, okay? When you're in residency, your day is completely different, and I can speak to that if you're interested, but during residency, you are mostly on an inpatient and mostly have weekends off here and there, but you're mostly in the hospital like 70% of the time. You're doing 6 days a week, mostly 8 to 16 hours a day. Residency is very difficult, but it gets better and better as you progress and as you progress in your training. So I just want to make sure that everybody understood that when I say hospital 7 day on 7 day off, that's a career that I'm a chief resident now. Next year, that's the job that I'm looking for. So that's just a clarification. And if you have more questions, please ask me. In terms of research, you do not have to do MD PhD to do research, although because there's so many MD PhD people now and it's so common, if you want to be a successful researcher and you want to establish your career as a prominent researcher, then you probably are going to need those skills. But I can tell you that one of the MD PhD mentor at the University of Minnesota is not an MD PhD. He's actually an MD only. And one of my mentors in some of my projects, he's only an MD, and he does 70% of his time is research and 30% is seeing patients. So you do not have to do MD PhD to do that. However, if you are really interested in establishing a career in research and incorporating research into your career path, I will say that seeking MD PhD is not a bad idea because even financially it's helpful. Why do I say that? MD PhDs for the most part are funded. So by the time you finish 7 years later, you are going to be walking out with an MD PhD and 0 loans or very little loans. If you compare that this is strictly from a financial perspective, if you compare that to a person who does 3 years of residency, it takes at least 10 years for you to get out of your loans or to become financially free. So at the end of the day, I find it valuable if I was really interested in research and I was that smart. I don't think I was that smart or knew the process to do MD PhD, but I probably would have done MD PhD. So look into those programs if you are interested in research and have financial interest.
Thank you, appreciate it.
You're welcome.
Yeah, Kaylee and Hallie, you also had your hands up.
We can go to the next person. If they want to talk again, they can just start talking. I'm gonna butcher the name, and I'm so sorry. But it's
Toby.
It's okay. Yeah, I go by Toby, by the way. Thank you for doing this, by the way. I just wanted to ask about you. Explained what a typical day for a physician would be like, but what does your job as a chief medical officer entail?
Good question. A chief medical officer is not the official title of mine. It's a chief resident. And what that is a chief medical officer is if you go travel to other countries, like many African countries, they have what we call a chief medical officer, who are typically leaders of the hospital, like a smaller hospital or whatever. My role, so what does a chief resident do? It's a glorified extra training or extra year. So for an internal medicine person like myself, who did 4 years of medical school, did 3 years of residency, I took an extra year to act like a full physician and a resident at the same time. Basically, a lot of my job is to do resident training, a lot of administrative work, so resident scheduling, resident teaching, supporting the residents in many ways. And the other part is I do a lot of clinical work. So my time is split half and half. Half is clinical, half is administrative. When I say clinical, that means I'm seeing patients. Like I said, I see patients here at the University of Minnesota. I see patients in Rosebud. And so that 50% is cut between 20% at the University of Minnesota, 20% at Rosebud. And the other 50% is basically helping residents support a lot of administrative work, but also doing projects that whatever I want, like whatever projects I want. Now, that's a typical chief resident. For internal medicine, you usually are going to take an extra year to do that. For other specialties like surgery, family medicine, like radiology and neurology and other specialties, their last year of residency becomes their chief year. So but basically chief year is a leadership position that you assume either towards the end of your training or after your training to gain more experience in administrative. So this kind of role is a gateway towards like medical education. So if I want to get a job in the future as a medical educator, like a program director or something, this would be highly valued.
And I also just wanted to ask, what would you consider like your least favorite part of your current position?
Oh, that's a good question. Least favorite. I don't get to see a lot of the residents right now because of my role is slightly different from the other chief residents, and there's a bunch of chief residents in our institution actually, but I don't get to see that many of my residents, which is really what gives me a lot of hope, is just interacting with them and hanging out with them and teaching them. I'm very independent in what I do, which is like kind of just like behind the doors and not really interacting with them on a daily basis. And I tend to miss that very much.
Wait, we have Eliza, your hand's raised.
So I was just wondering, as far as internal medicine, why did you choose to go into that? Like, was it more intellectually stimulating for you than other jobs, or what keeps you engaged and interested in it? Because I feel like after med school, you're going to feel like you aren't learning as much, and it might feel frustrating. Did you ever experience that?
So I chose to go. I'm actually at the end of my medical school, I struggled between going to surgery and internal medicine, which are two different specialties. I like the surgery because it's kind of like you do your job, kind of like there's, that you start and you finish your task kind of thing. And you also see, somebody comes with a gallbladder issue, you fix that gallbladder and you send them home, you're happy with that, and they may not come to you for years and whatever. But for me, eventually I decided to do internal medicine, and I'm wholly happy about that, by the way. I'm so glad I didn't go into surgery, and I could please go to surgery if you want to, but for personal reasons, I'm really glad I didn't. Because I just have a lot of loans, and I didn't think that sitting in residency for additional 7 to 10 years was useful for my well-being, for my financial and personal well-being. I am a first generation college educated. I'm the only physician not just my immediate family, but my entire extended family, including my entire village in back Ethiopia. And I have a lot of nieces and nephews, and I just felt like I was going to miss a lot of time from them if I did a 10 plus year residency or 7 plus year residency. I will tell you that if surgery was 5 years, I probably would have done it. But I find internal medicine to actually give me time to think, time to really be with my patients, and time to also, it's very intellectually stimulating. Like, it makes sense to me. When somebody has a heart failure, I can go through the entire pathophysiology and then understand what's missing and also give them medications to try to help that. And that aspect of internal medicine is very stimulating to me, and I'm forever grateful that I chose this path.
I don't know, Haley, your hand's still up. I don't know if you still have a question or no. Okay, we'll go to Maria.
Oh, sorry, I do have one. What is like your work-life balance now that you're a resident?
Yeah, it's a good question. Work-life balance is I don't necessarily look at it as like, this is my work and this is my life kind of thing. I think that like my life is a bunch of like living, and that involves like working and like relationships and everything. And so for me, am I happy with the way I live on a daily basis? Yes, I'm very happy. And I think that also a lot of it has to do with your attitude towards life. So residency is stressful. Sometimes you can feel overwhelmed, drained, used by the system, and just really feel burned out. There are a few things that I tell my pre-med students as well as my early starting residents. Some advice that I give is pay attention to what makes you happy, and even when you're busy, try to do them. So when you are at work 8 to 16 hours a day, 6 days a week, which is during training, during residency, that can get to you. And for personally, after those days, I would still come home and run because I really enjoy running and being outside. On my days off, I still cooked. And I try to not bring in work to my home. I mean, right now I'm at home, so it's kind of all mixed up. But if I'm doing clinical work and if I'm seeing patients, some people tend to bring their notes, for example, the documentation to their home, or on their days off, they try to document things or try to follow up on patients and stuff. I don't do that because I want to separate my personal life with work life. Not separate it, but really like I want to have the time for myself at home. So you will not see me a lot of checking on my phone. A lot of people check like before they go to work, they're like checking things. As soon as they wake up, they're checking things, and I'm just not that person. I try to have my time for myself and work for work kind of thing. I try to I try to separate a lot of things, especially when it comes to work, and I try to not let it consume me. If that, I don't know if that answers your questions, but that's kind of what I do.
Thank you.
You're welcome.
Emily, are your hands raised?
Hello, can you hear me?
Yep, we can hear you.
So my question is sort of weird, more or less. So I'm also a first generation student here in the United States, and none of my parents have finished high school or graduated college, but they were able to put like, from their home country, they put like so much of their culture on me, and I want to give it back. Do you know like of any resources or of any sort of like tips if a person that was trained here, a medical residency here, they will be able to practice in a different country?
Can I ask Emily, what country are you from?
I'm from Ecuador in South America.
Okay. Yeah, I think one of the beauties of training in the US is honestly the privilege you have to go around the world and practice. The opposite is true. If you trained elsewhere, coming to the US and practicing is almost impossible, and it's a really it's a big task. But if you're trained in the US, you have a lot more access to go to the country of interest and practice. So I'll give you an example. As a third-year resident, and I was in Tanzania between January and March. And I actually was able to practice in one of the hospitals there and directly care for patients as well as teach trainees in medical education. So I will say that you would be able to, and there are so many resources out there to do that, and a lot of support as well. And I'll just say that if you're interested in doing that kind of work, I would look at, when you apply to medical school, I would look at schools like the University of Illinois, which have a dedicated pathway to support you, as well as the University of Minnesota, as well as I think the University of Washington, correct me if I'm wrong, but some schools already have a carved out structure for you to do global health, whether it be it nationally or internationally.
All right, thank you so much.
You're welcome.
Okay, since we're coming to the end, is there like any final question? Anyone can just pop it and say it.
I would just wanted to ask a second question, if that's all right. I wanted to know if do you see any issues of being a doctor come into your life, of being I don't want to say necessarily a wife because I don't want to assume that, but of your family life? Because being a doctor is such a demanding job, do you find that sometimes it really takes away from being with your family, whether that be your children or your nieces and nephews?
That's a really good question, and I do not have children on purpose because I personally didn't think I could handle children and medical school and residency. But I do have a lot of friends and colleagues who are mothers and wives and everything, and are in a great relationship. I will say that as I think the hardest part of those kind of relationships is probably during residency, when you put in many hours. But it's definitely doable, and as you come out of residency, then things tend to get easier, because you don't have to work. You can, as a physician, the flexibility of your job is amazing. You can decide how many hours you want to work. Like, I can say I want to work 20 weeks a year and that's it. You kind of decide in how much time you want to put in and how much you want to earn based on your family. So it becomes a negotiation between what you want to do, what your priorities are, right? Nowadays, actually, in the past, being a physician used to be everything, right? Like, if you were a physician, your life was about being a doctor. Society saw you that, your family saw you that. Now it's really not like that. Many physicians have many interests, from podcasting to politics to writing books to other things that, and relationship is becoming very important. It's not something that I'm like, oh, my husband is going to take care of things at home and I'm just going to do whatever. It's not becoming like that. So basically, I think that by the time you guys come out of medical school and start residency and things like that, things are going to be much different, because they are already better for me than they were 10 years ago, in terms of recognition of the personal relationships that you're supposed to have, and the values and the expectations. I will say that communication is really important. I have a very supportive partner, so I'm lucky in that, who, I have never had to struggle or had to choose between staying home, being with him, spending time with him versus like, you know, advancing my career in any way. But communication is always important. So with your partner, you have to communicate what are your values, and if it's money, then you're going to work a lot more. If it's not, then you're going to reduce your hours at work and you know, and focus on your relationship. So does that help?
Yes, actually, that meant like that answered so many burning questions. Thank you.
Okay, great. Awesome.
Okay, I think she had the last one. If anyone has another one, speak now.
Okay.
Oh, sorry. You can go first.
Okay. I'm sorry. You mentioned earlier about like the financial hardships of med school and just the journey of becoming a physician. What did you personally do to, you know, avoid student loans and accumulating a lot of, you know, financial baggage?
Toby, I wish I was smart enough to avoid those things. I was in a very different position where every part of, like, every living thing that I had to do for life came from loans. Some of you may be lucky to have some sort of support from some family member or some work that you've done in the past or inheritance. For those of you who don't have that, it's okay, because I didn't. In fact, I had to take out some loans to help my family members. So I was in a very different position. So I ended up with a big chunk of loans. But what's important is that my awareness to it, right? I'm very aware of what I have and how I'm going to approach in paying it. If there is a single book that I can recommend to every health professional, especially at your age or where you are, at your stage, not your age, at your stage, is The White Coat Investor. It's written by a physician. I can send it to people and you guys can have it, but it's called The White Coat Investor. It's very, very famous book. It should be more famous than that. And what I'm going to tell you to do is actually read. You can read the whole chapter. It's a very small book. You can read the whole book, but don't feel like you have to understand the entire book. And what I like you to do is have that at your home, and then read the chapter that is relevant to you every time you hit that milestone. So there's a chapter for pre-meds. Read that chapter when you're a pre-med, and it's going to help you how to select schools, what that means, et cetera, et cetera. At the end of your, kind of when you're hitting like your fourth year, third year of med school, read the one about residency. Okay, so I read that book at the end of my med school, and it's been life-changing. I will call it revolutionary. I mean, it completely transformed my understanding. So one of my specialties in the future is actually to help first-generation physicians or anyone that's interested in being financially well as a physician, and really try to support them to not have as much loans. So that's a book that I would recommend highly, highly. He also has a blog, and he also has a podcast, but I will say the book is probably more useful at your level.
Thank you.
You're welcome.
So my question is also about, you know, money and finances. So I'm a first generation student. Actually, I'm an international student. So for me, I'm not right now, I'm doing undergrad. I can't take loans or get scholarships or anything. But do you know if when you get to med school, if they have any sort of financial like aid for international students?
Because I don't know a whole lot about this. However, I will say that I think that the level of support, financial support from institution is very scant as you progress in terms of like when you try to go beyond bachelor's degree, especially for international students. I am friends with a lot of international students and people that went to like pharmacy, dentistry, and medicine, and a lot of them had to have a cosigner to take out some loans.
Okay.
And so I would just explore that area. And unfortunately, the white coat investor does not address that as well. So I'll just encourage you to look out for some resources online and talk to people that may have had to go through those.
Okay, thank you.
You're welcome.
Okay, well, thank you everybody for coming and taking advantage of this opportunity. I hope you guys learned a lot. I know I did, coming from being a first generation student and also coming from a community college background. So that was really helpful. We'll have another meeting planned next week and we'll keep you guys updated. So thank you guys so much for coming, and thank you, Dr. Gebreslasse, for your advice. It really helped a lot.
I'll just say that even though COVID is throwing a wrench in everybody's life, this is really good, and you can definitely put this on your resume, especially if you're a junior and you don't have that much ability to have to really see firsthand in what it means to be a physician on the wards or in the clinical setting. You can say that you've had these discussions with many providers and try to attend and have a perspective. This is exactly what we did for the summer as well for St. Olive kids. So I think that you guys should continue to do that, and this would be something that's positive. It would be seen as a positive on your applications as well. So it's very nice to meet everybody. It's a pleasure. I wish you the best in all of your endeavors.
Thank you so much for coming and taking your time. It was really helpful. Thank you so much.
Thank you.
Okay. Bye, everybody.
Bye. And again, a reminder, next week we are having another meeting if you guys want to come again.
Oh, I just have one last question. Sorry for asking so many questions. Is there a way to confirm that, like, our attendance?
Yes. The number one question we've been getting, so we've talked to other professionals because we know a lot of students, a lot of you guys want to put it on your resume and all that kind of stuff. And the number one thing they said is as long as you incorporate it into your application, what you learn, like the discussions we have, that you were active in the discussions and all that kind of stuff. And then for certification, like us giving you like just printing out a certificate and giving it to you is kind of the same as you just finding one online. So if you like reference us, we are found, we have a website, we have a YouTube channel, we have all these things. So if they're ever going to double check to make sure what you did was legitimate and good for your application, they can definitely easily Google us, and you can send us, put the link to our information on your application. So that should be the equivalent of kind of us verifying it, or them verifying that you actually did these hours.
Okay.
Hopefully see you guys next week. Thanks for coming.
Thank you.
Thank you. Hope you guys see you guys next week. It's Tuesday, September 22nd, 1:30 Central Time, and it's gonna be It's gonna be a pediatric surgeon that's coming next week.
Are you guys gonna send us a link about it? Or okay, awesome. Thank you.
Definitely, yeah. Thank you so much for coming.
Bye-bye.
Bye.